breast cancer treatment is multimodal. Most patients will have surgery and may have radiotherapy, chemotherapy, or endocrine therapy. The problem is that we've increased the amount of treatments patients get, and we're increasingly finding out that not all women benefit from all treatments, but all patients will experience the side effects, which are potentially life-changing. So there's increasing interest in personalising breast cancer treatment. But this is very much driven by professionals. So we did an international patient survey to find out what treatment patients would like to avoid if it was safe to do so. So we did an international online survey using REDCap. We included over 230 patients from across the world. We captured some information on the treatment that they had for early breast cancer and what treatment they would like to avoid if it was safe to do so and why. We also asked them for any additional comments they had about studies looking at reducing breast cancer treatment or personalising treatments. So, as I said, we had over 230 patients respond. Most of them have had surgery. A good proportion had had radiotherapy and chemotherapy. And the results were a little bit surprising. As we expected, about 30% would have avoided chemotherapy if it was possible to do so. And the reason for avoiding chemotherapy was often given as the brutal side effects of treatment, both short-term and long-term. And also the fact that having chemotherapy with hair loss actually identified them as being cancer patients, and they really hated this and the impact it had on their quality of life. About a quarter of patients would avoid endocrine therapy, and the reasons for this were, again, side effects both in the short term and the longer term, and the profound effect that the endocrine treatment had on their quality of life. Endocrine therapy was described as an aging treatment, and women constantly questioned whether the benefit of taking these tablets, which profoundly influenced all aspects of their life, particularly their sex lives, was actually worth it. Almost 20% of women said they would have liked to avoid surgery. And it wasn't all surgery, it was particularly mastectomy and axillary clearance. And I think as surgeons, we often think that surgery is fairly well accepted, but actually women's responses were visceral. They described surgery as being mutilating and giving long-lasting impacts on their quality of life and well-being and relationships. Women would really have liked to avoid axillary clearance because of the side effects, the lymphedema, the chronic pain, and this was a recurrent issue. Radiotherapy was surprisingly well tolerated, with less than 10% of women saying they would have chosen to avoid radiotherapy if this was an option. And the reasons given here were mainly logistical. So they described difficulties travelling for 15 treatments or being away from family. But this was much of a lesser concern. Patients generally were really supportive of the idea of increasing personalisation of breast cancer treatment, but all of the women who responded emphasised that survival was their key priority, absolute priority, and that any research looking at reducing treatments would have to be very high quality to allow them to feel confident. And what they really wanted was high quality research to help improve personalisation of breast cancer treatment. And I think the results of this survey give a really strong mandate for the design of studies looking at reducing unnecessary chemotherapy and endocrine therapy in the future, as well as improving surgical options for many women.